So it's 8:43. Thousands of medically qualified refugees could help ease NHS workforce pressures if specialist programmes to help rebuild careers were expanded nationwide. That's going to charities and healthcare employers. An estimated 2,000 refugee doctors are currently living in the UK, along with many more refugee nurses, midwives, psychiatrists and allied health professionals. Yet, despite being legally entitled to work, many struggle to return to the professions they've spent years building. Olena Ipek is from Ukraine and is a doctor. Didn't get a licence to work here in the UK, though, so she's now volunteering. Morning, Olena.
Good morning.
Tell us a bit about your work background. How long had you been a doctor for in Ukraine?
I was working for 2 years after my graduation. I went into pediatric training, and I would say 2 years and 6 months.
And then, since you came here to the UK, you haven't been able to practice as a doctor at all, no?
No, because in order to practice here, international medical graduates need to do some exams, which include English tests, which include PLAB 1 and PLAB 2, in order to obtain license. So I'm done with all of these exams and applied for my license and waiting for it.
And how long have you been here for now? How long has that whole process taken?
I would say it's been 1.5 years. I'm trying to get this license.
And so you've applied now, and you're just waiting. And if you get, and hopefully you do, if you get the license, then you'll be able to start looking for jobs. Yes.
Yes, I will be able to apply for jobs as a doctor.
And what have you been doing in the meantime while you haven't been able to work?
When I came to the UK and I started to prepare for my exams, one of my friends told, what do you think about volunteering? Would you like to volunteer? And I thought, I thought about this. This is a good idea to come back into medical environment, I would say. Once I applied for volunteering and started to do volunteering, I feel that I came back to medical practice, which I would say, it's kind of this. And my trust, Kent Community, NHS Trust, they offered me a volunteer to career program, which with Helpforce organization, and I was so grateful for this opportunity to shadow teams and to see how NHS works.
And were you missing doing medical work when you were unable to do it before you started volunteering? Was it quite frustrating not to be able to do your job?
Yes, it's quite frustrating because you have when you have some qualifications and you know that you may help people and you have skills which could be helpful to others, and you cannot do it because of barriers as these exams which you must do. It's a bit frustrating, I would say. Yeah.
Well, good to speak to you this morning. Thanks very much, Olena. Good luck with getting the license.
Okay, thank you very much. I'm also grateful to all organizations like Helpforce, NHS Employers, Breaking Barriers, and the Ukrainian medical charity who helped to come back to a medical environment.
Yeah, absolutely. Thanks very much, Olena Ipek there, a doctor from Ukraine. As she mentioned there, talking about an appeal to make it easier for people like her to find work in the NHS, organised by those various groups she mentioned, Helpforce, NHS Employers, Breaking Barriers and the Ukrainian Medical Charity. It is 8:47.
Now, more than 100